It's Dr. Robert Strang, Chief Medical Officer of Health. I'm here announcing that we now have 7 new cases of COVID-19, which brings to a total over this weekend, today Sunday and yesterday Saturday, 13 new cases, to a total of 28 cases in Nova Scotia. All of those cases so far are associated with travel or close contact with a previously known case. Individuals affected are in the ages from upper teens all the way through to mid-70s, and we have cases across the province. Public health in each case does their work to identify close contacts of that case, and we work with those close contacts to make sure that they're in self-isolation, and we work with them on a daily basis, monitoring their health and taking appropriate steps if they become ill. We've had almost 2,100 tests done in the province, and 2,088 of those are negative. The good news is today that we are now able to test at the QE2 Health Sciences Center microbiology lab, that both the tests, negative and positive tests we get there, can now be considered confirmed tests, and we no longer need to send samples off to the National Microbiology Lab. Even though we still have all our cases are not showing, none of them are related to local community spread. This weekend is concerning, 13 cases. We are going to continue to see more cases, and the reality is we are going to see, in all likelihood, signs of community spread, and we're actively enhancing our surveillance to look for that. It's at this time where it's critically important. We're at the beginning of this pandemic as it enters Nova Scotia. It's the time where we can have the greatest impact of minimizing the spread, slowing down the spread, limiting the effects on individuals, putting the greatest protection for those who are most vulnerable, protecting our healthcare workers and our healthcare system. We have the good fortune of being able to look at other jurisdictions, even in Canada and globally. And those who have put on early the strict measures that we have been putting in place all this week, that have been enhanced today, are what's necessary to minimize the impact of a serious disease in our province. So while I acknowledge that the restrictions are very disruptive and life is very different now, it's absolutely necessary that we all do this together. It's unfortunate we are still seeing people that over the weekend and out in large groups in public. So I want to just clarify that for people who are all of us required to be social distancing, that it is okay to get outside, to walk around your block or in your neighborhood. But you got to do that in small groups, and by small, we're now saying no more than 5. At the same time, sticking with that 6 feet or 2 meters apart, the social distancing. It's not okay to kind of have everybody piling in cars, driving to a park or a beach where there's hundreds of other cars and everybody getting together. That's not common sense. That's not respecting the public health measures of social distancing and limiting gatherings. If we're social distancing, don't everybody go shopping together as a family. Have one person go to get your essentials at the grocery store, one person to go to get your essentials at a pharmacy, and everybody else should stay out of those stores. For people on a higher level, anybody who's now a returning traveler, and as of tomorrow, anybody traveling outside of Nova Scotia, they are on self-isolation. And that means no shopping. Somebody else has to go get your groceries. Somebody else has to go to the pharmacy for you. If you need help, there are lots of mechanisms being put in place in communities to support people, and I would encourage communities to support families who need help in self-isolation. If you have the capacity, if you're on self-isolation, you can go on your balcony. You can go out in your yard, but no further. It's not going out more widely in your community. I know that this puts challenges on people in apartments and multi-unit dwellings, but it's really important that those individuals get support to be able to remain self-isolated for that 2-week period. And anybody on self-isolation, if you become unwell, use the online 811 screening tool to check your whether you need to be tested, and that will then if you have fever or new cough, then you'll be directed to call 811 and then be sent into an assessment center. So using the online 811 screening tool first, if at all possible. If you can't have that, then calling 811.